Public Health Specialist and CEO Medway Health Limited, Dr. Tuyi Mebawandu, joins us this morning to talk about this. Good morning, and thank you for joining us on TVC Breakfast.
Good morning, Vero.
Now, so many issues has come up since the reopening of international flights and the protocol put in place by the government. A lot of complaints talking about it being cumbersome, the process for testing, and then there is now the issue of racketeering and the capability of this testing, perhaps to those places that they are meant to go do the test. So many issues coming up. And then there's also the cost, which a lot of inbound passengers are complaining about. What is most concerning when you hear all of this back and forth, knowing that this is all about safety that the government is trying to ensure?
The main concern would be this, that we're gradually jeopardizing our fight against the resurgence of COVID-19.
Really?
Let's understand this clearly. The first set of cases of COVID-19 came to Nigeria from somewhere abroad, okay, Italy specifically. Now, one of the key things to prevent resurgence of COVID-19, or what we call a second wave in this country, will be one, to ensure that we have proper testing of those people that are coming into the country. It is very essential. And the process must be seamless, must be transparent, must be clear enough, must be so patient-friendly. But what we're seeing all over the spaces is that there are a lot of challenges for the people. They are not getting the laboratory. The cost is so exorbitant, and the process is so cumbersome. So again, this one will bring in some sharp practices within the process and then further compromise our fight against COVID-19.
There's the issue also of fake laboratories.
Indeed, fake laboratory, dubious payment, and all those things are also coming up. These are the things that shouldn't happen. Now, it is better, for me, I look at it this way. The first starting point would have been that to insist that some of those clients, if it's possible, for them to do testing even from the place of origin, right, from departure. Now, there it could be easier for you to say that, okay, if you're coming from India, you're coming from, let's say, USA or China, get your tests done, send it ahead so that we can see it. If you're going to live here, of course, it is proper for you to do those testing before you depart.
Now, quickly before we let you go, you said that this is perhaps jeopardizing our efforts towards curbing the spread of the virus. In what ways now, if we are to talk about trying to block every loophole, in what ways are we jeopardizing, and how do we block the loopholes?
If you don't test, how do you isolate?
Right.
If the test is not credible, how do you now react? So again, the critical pillar of combating COVID-19 is testing. Key. Testing is very key because testing will determine the extent of the spread of disease in your community. Then secondly, of course, social distancing and all the requisite things that you need to do and ability to provide isolation. So these are key things, but if you don't do testing first, how do you know who to isolate? How do you know who to treat? How do you know how to respond? How do you do contact tracing? Obviously, testing is key. Without getting it right, what are you going to get right?
All right,
what you don't test, you don't see.
All right, looking at the issue of fake laboratories now, it's a big concern for us. So the Lagos State government recently accredited about 7 laboratories to carry out COVID-19 tests. And so we're having this issue of fake laboratories, excessive charges and all of that. Where do we go from here? How can government see to it that this stops?
Well, again, it's their function. They have the Association of Laboratory Scientists. They have the regulatory agencies. And they have the right to direct people to where they think they can get the best result. Now, there has been a challenge of quality and monitoring in a lot of issues, not just health institutions. And this is what we have to really ramp up. Now, what can, again, be a game changer in terms of this COVID-19 test is to see whether we can deploy some rapid tests. We saw a new one that has been developed recently.
Absolutely, yes.
Yeah.
Okay, if we develop that, then that will help us to do quite a large number of testing. But as far as fake laboratory is concerned, it has to deal with the communication between the government and the people as to the laboratories. Are you saying the
communication the government gave is not clear enough?
Hey, tell you what, you see, there's a lot of loss of communication and quality communication, even from the beginning of this COVID-19.
Really?
From the beginning of the COVID-19, we lost the war first by not communicating properly. we lost the information management.
What would it have been? What would have been the proper way to communicate?
Tell you what, there are a lot of stakeholders in the spectrum of COVID-19 management. What has happened is that government sat on top of it and felt that they can do everything by themselves. Now, what I mean by stakeholder is this, you know, from your local community to your church, to your mosque, to your associations, various associations, these are key people that can help to communicate, you know, the right response to COVID. In fact, when it now comes to this laboratory challenge now, the communication we had is that, listen, these are the number of laboratories scattered and some of them too far from people. And the process of collecting the specimen was so cumbersome. Some had to come, collect, waited for so many days or sometimes up to more than a week before they get the result. And then the cost is exorbitant. There are also hidden charges. All these things are compounded people's trust. Because don't forget, what we lost in COVID fight, especially in this part of the world, was first of all public trust. There are a lot of issues. People are saying that, is COVID real? Is it not real?
And this seems to be compounding issues of trust as well.
It does. It's an issue of trust because, again, okay, look at the time that a whole more than 30,000 patients were discharged at a time. That was not properly communicated for people to explain. And it became an issue on social media that how can government discharge 30,000? What happened? And then, so we have to work hard because in public health, truth and sincerity is the first thing. Once you lose that, you lose the whole spectrum of fight against such epidemic.
Looking at the testing kits that was just developed now quickly, how can the government ensure that it goes all around? Quite right, it's a cheaper option to get into the other testing kits we have.
Heartwarming, very heartwarming, because again, like I said, the pillar of COVID, any pandemic, is to be able to do testing. What the testing kit does is that it's rapid, because within 40 minutes you get results. It's cheaper, maybe about
2,500
2,500 naira. It's wonderful, that's cheaper. Then it is mobile. You can then move it from one location to another, especially in rural areas, where the challenge of having to take specimen from that rural area to a center, a laboratory center. And then you don't really need high-skilled people, you know, because right now if you are doing the conventional PCR test, you need an experienced laboratory scientist, you need a machine and all those costs that will come into it. But this time around, we hope that will help us to ramp up the test and let us understand the extent of the infection of COVID in Nigeria. Because let's face it, you can't be testing just 500,000 people out of 200 million. That's 0.05%. You are not doing anything.
So much still has to be done. Dr. Tuime Bawandu, thank you so much for your time on the program.
Thank you.